Aniza kukulira media olunaku olwaleero nga tusinzidde wano ku kitebe kya disitulikiti ey'Embale e Maluuku era ng'ensonga etuleese wano olunaku olwaleero y'ensonga ya minisita omubeezi ow'ensonga z'ebyobuvubi nga ye Helen Adowa era nga azze okusinkanamu bekikwatako mu nsonga ez'enjawulo omuli ebyobulimi n'ebyobulunzi ng'ensonga eriwo y'okuba nti bakubaganya ebirowoozo ku tteeka eppya eri mu nteekateeka gite policy ey'okuba nti abalimi n'abalunzi babaako akasente akatono ke batoola mu luzungu ky'oyinza okuyita cost sharing ku ddagala eriba lifulumiza. Kinajjukirwa nti mu kaseera kano etteekateeka eno weebereddewo nga eggwanga likyagenda maaso n'okutoba n'ekirwadde ekya foot and mouth disease. Ekirwadde kino kyoyinza okuvvuunula nti kalusu era ng'ekirwadde kino kikosezza ebisolo ebiwerako ddala. Kati gavumenti egezaako okulaba nti ekirwadde kino kyeyongera kusaasaana era nga mu kyo mwe kulaba nti etteeka lino lireeteddwa mu kulaba nti n'abalimi babaako kye bakola oba kye bawaayo n'abalunzi mu kulaba nti eddagala lye bakozesa lisobola okuba nti bo baba bataddemu kasente kiba kibakakatako nnyo okulaba nti balikwata bulungi n'ebisolo bye bajjanjaba bisobola okuba nti bifuna mu ddagala. Tutuukidde olunaku olwaleero nga ebisolo mu kubalako ebisolo okwasemba okukolebwa kulaga nti ente ziri eyo mu bukadde 40 n'omusobyo era nga n'okukosebwa kw'ekirwadde ekyakalusu kukosezza nnyo abalunzi ensonga ki gavumenti evuddeyo n'enteekateeka ez'enjawulo okulaba nti ekirwadde kino tekyeyongera kusaasaana. Katubikulage.
It will make first of all, our extension workers active. The truth is, extension workers are not normally with our farmers. But if the farmers started to contribute, it will give them some motivation to go and support the farmers. But also, in government, in cabinet, tell government to increase funding for veterinary department. I'm sure even in Ministry of Agriculture where you sit, veterinary is underfunded. And that's very, very bad. The same up to district levels. Veterinary department is the most underfunded sector. So there should be some increase in funding. And then the other thing, Tororo district is now the headquarters of Bukedi, and it is a regional headquarter, therefore. Because we already have High Court, we have regional police headquarters, we have regional drug authority, we have the DPP office. So this thing of the laboratory which you are talking of for region in Mbale must also be in Tororo and to serve that area. And the good news is that we have already constructed a block. You just need to come and put some equipment there such that that area can be serviced. And to tell you, Tororo now, you know, Bugiri falls under Busoga, but Tororo is near, because I've seen even High Court, Bugiri does not go to Jinja. They come to Tororo, it is easier for. So if you put a regional laboratory in Tororo, it will serve Busia, Bugiri, and the whole of Bukedi districts. So I thank you for this input. And maybe you are not for health, you are for agriculture, but the same thing should be done for health. Our hospitals, let us not lie. People are already contributing cost sharing. And you know it, I saw you people quarreling in Parliament when National Drug Authority took long to put about, was it 7 months? So what we now get in our government hospital are just technical what? But the real medicines, people are already doing cost share because they just buy. So let us formalize such that someone is aware. Because this is bringing conflict with us, more so the politicians, quarreling with doctors for nothing. You quarrel with them, but the truth is medicine is not what? So let's do cost sharing there. We do also in veterinary and so on. Thank you for God and my country.
I think I also join my colleagues to say this is something good that we should embrace. But at the same time, we have to be careful about the stages. Oh, I'm Fabiano Aholi, a farmer, as I said, dairy farmer. And my worry is, I'm not a doubting Thomas, but my worry is there are several centers handling this, right from the ministry up to the district. And if it's not properly done, there will be delays to deliver the vaccines. As we said, the vaccines can come to the district, but if not properly handled, they can even lose their potency, right? Expired. Expired, yes. If it is expired, then you take the vaccine, the animals, you hope as a farmer that it has been vaccinated. When what has entered the animal is already expired.
Mouth disease. Once last year, actually, I became a victim. In Uganda, if you had that is problem in Uganda, I was one of the victims. This is a disease which is not easy to treat. If you happen to get a single case, it is too expensive. Treating an animal, it costs like 200,000. So it is just a matter of sensitizing our farmers. And for your information, Honorable Minister, this is timely. I thank you for sensitizing leaders. When leaders, we are informed. And it is dangerous. You rather stay with a person who is ignorant than staying with a person who is misinformed. But now, if we are informed, we can transform our communities. These people need just sensitization, they need information. You show them the problem and the repercussions in failing to vaccinate an animal. It is keeper. So, Mama Minister, this message should not stop here. We want you up to our district levels. Don't think that when you see these officers here, we'll go and do the work. On a serious note, you take it from me. Our veterinary officers are idle. They don't work. They don't go and visit farmers. It is only... Yes. Make it. So another thing, what I want to tell you, the program which had brought them on board was Operation Wealth Creation. It is now they are now back seated. It is only the PDM which is again waking up these officers. But the only problem we have, these officers are not facilitated. We need a budget for these officers. For implementation, they are not working because they are not facilitated. And when you talk about facilitating, from which vote? When you ask the cow, the department is independent. But the department which is independent is not facilitated from the ministry. Doctor, you are aware of this. They no longer have motorcycles. I don't see whether my vet officer has a vehicle. I last saw that vehicle some time back. So, we need facilitation.
Mr. Nelson Elungatlakol is my name. Once again, the district chairperson Kumi. One, I want to thank you specifically for the highlights that you put before as the opening up this engagement. Number two, I want to say that government has taken a very brilliant approach just building from your highlights, there are people that want to enjoy from where they are only enjoying looking at. I have animals, you find animals with a lot of things, you find animals like that, but the owner is there, and perhaps he thinks somebody from either Europe or Asia, Australia should come and attend it. So this is one thing that is actually going to help all farmers to be proactive in managing up their animals. That is number one. So the model or the policy is made in such a manner that it's actually going to have a system that works. A system that works. How does it work? One, all the roles that each player, each stakeholder that is supposed to play are there. Now, what is incumbent upon now government, besides only taking up a portion of supplementing up the cost of other activities, my prayer would be that the aspect of taxation, in as far as these vaccines are concerned, is properly managed, because it's one area that is likely always to shift up the burden down to the farmer, and therefore kind of making the whole ideal ridiculous. Please take this one, Madam Minister, very, very seriously. You know, it should be looked into as we get down to implement the aspect of taxation. If government can either put either the downsizement or a subsidy or whatever, it would be good specifically for this one, so that as we have the account, fine, we put on the revolving fine better. Now, what is it next? Easy, only to put up the information that already Minister of Finance and Minister of Finance, Planning and Economic Development has already established the account. And then we start piloting the process. There is nothing that should be questioned about this. I want to thank everybody for listening to me. Thank you.
With what has been there already, because as mere, you know, our local people, they used to free things, but now trying to change them, to make them contribute something. I'm seeing a very big resistance coming up. So I was trying to ask you now, you said the implementing body will be the local Minister of Local Government, which includes the RDC, DISO, and the lower local leaders. Now, before, the government has been sending vaccines, like recently, for us we had a quarantine in Budaka district, and they brought those vaccines, they vaccinated all cattle in Budaka. Now I'm looking here, whereby farmers will be contributing something, and you find that some farmers may manage to contribute and others will not. And maybe there is a break, there is an outbreak of that disease. How are we going to implement this? Are we going to have this as a bylaw in the local council? What is the RDC, DISO, and these local leaders going to stand on to see that it is implemented in their areas? So my worry is all about there.
We are putting a lot of emphasis on FMD, and yet we know there are a lot of diseases that affect the export market. What is the government's position on that? And also on that, we know most of the drugs are bought by farmers. Why can't the government do the regulation bit through regulating drugs, making them available, including these vaccines, and allow farmers to buy these drugs by themselves without taking this route? Because a lot of process, I'm happy one of the farmers has already brought it in. There are a lot of process that is being involved. And in the end, I'm talking on behalf of my farmers in Butaleja, because 90% of them are smallholder farmers, and they are poor farmers. I don't know if they will not be able to really contribute in time and be able to achieve maximum coverage at the same time.
Presentation was really digitalized. The vaccine is going to come in a digitalized form. And these farmers, because we have a challenge with VHTs, doctor, you are aware, they even don't know how to use their mobile phones. They always register wrong mobile numbers. Then they come to RDC, I was not paid. RDC, I don't know how to feed in the numbers. RDC this. So we have a challenge. And the FMD, according to Honorable Minister's presentation, it is basically digital. The farmers need to be knowing. So that is where my concern is. We shall sensitize on radios, but I'm not sure they will get the knowledge.
We know foot and mouth disease is a state control disease. Now that we are going to talk about payment, my worry is about the private sector. Now that it's going to be for payment, it should really remain the government solely buy the vaccine for foot and mouth disease. My fear is once there is money and it is people are paying, private sector might jump in and struggle with the government that they are the ones who want to bring the vaccine in the country. Thank you.
Madam Minister, I forgot one point that is very important for you to put it up in cabinet. The extension workers that we are talking about here, we have a number of local governments, but we have a few extension workers. So they struggle for these extension workers to make the farmers. So put it within cabinet that before we take on with this strategy, we must be having adequate number of extension workers addressing farmers from each local government. That is one very most important point that I needed to put on your table very, very clearly. Thank you. Dr. Mele.
Thank you very much.
This program was tried in AMDAT. AMDAT got some PPR vaccines under Mercy-Cops from Ministry of Agriculture. And they requested that they wanted to create a revolving fund in the district so that the farmers would have their animals vaccinated, they make payment, and that money is kept at the district account. Then, when they would need vaccines, instead of waiting for MAIF to provide, the local government would procure. And we had very tough arguments over that issue because the government position was vaccines must be free of charge, especially for this public. Now that government has taken up this policy shift, it is for our own benefit. I also want to update you that disease control is not only managed through vaccination. Diseases move a lot with movement of animals. And when there are quarantine restrictions, we are not punishing you for closing your markets, for closing your butchers. We are simply protecting the spread of the disease. But this is where we get a lot of challenges with the local governments, sometimes with also our farmers. The disease comes during the time when it is school fees. For example, the Kumi and Bukedia quarantine restrictions, they came during time for school fees. And the Kumi was an exit district. And according to the quarantine letter, animals are not supposed to go through Kumi, a quarantine district. So the alternative route was animals to go. If you buy animals in Kasilo, you go up to Moroto, and then you start moving to Kampala. And the traders saw it was not cost effective. So we had a lot of arguments with the district executive committee of Kumi, trying to look out for what possible ways to ensure that people can trade irrespective of being in such. But when such a strategy is put in place, I am sure most of those challenges, we are going to minimize them. As of now, there are districts that have got vaccines. You can use those vaccines free of charge. Don't charge the farmers. There are 4 million doses of vaccines of FMD that are arriving to the ministry today. I'm reliably informed. Tentative tentatively in January next year we shall start implementing this process. But also I want to tell my district veterinary officers that we should use laboratories to diagnose and to be effective in detecting disease. Mbale has a regional lab for the whole of this eastern region. Moroto has another regional lab. There are about 12 regional labs in the country. And I'm reliably told Maif is building the capacity of Mbale laboratory even to test for FMD. The reason is when you detect a disease earlier, it is much easier to control it. Especially with FMD because it spreads. You know, COVID started in China, but COVID reached Mbale and even went to many other places. For us, in the animal sector, we are very happy for the people in health to also realize that quarantines were good. Before, they thought it is us, the vets, who are very bad. It's us who respect trade. We close people's markets, we close people's butchers. We don't want them to do trade. So, Honorable Minister, I've presented this foot and mouth control strategy under government's new policy, vaccination policy. Thank you.
Number one is let us go and sensitize our people, the farmers. We go on radio and talk about the policy shifts and also do some bit of mindset change. People now should accept that we need to cost share almost in every aspect.
Yes, that's one point.
That's one point. To sensitize people, and in the process also you're also mindsetting there. Okay, we can break down the two. That's okay. I'm just presenting to you. Number one is we go out, the people, through radio, through community meetings, and talk about these policy shifts so that people embrace it, because it's a cabinet directive. Then number two, the issue of mindset change. That one is almost everywhere. Even in PDM, we have that pillar on mindset change. So people should accept that now it is time for us to also contribute for our services. The other one is we need to utilize the existing regional veterinary laboratories effectively. That one was mentioned and was arising out of a request that we should have a number of them around, but we are saying we have one around but it's not properly utilized. Is it distance? How far is it from here to this place? So let us utilize what is available as we strive for more. The other one is the government to continue to procure vaccines and not to leave it to the private sector. Because this one we have known that sometimes counterfeit comes out of this issue. The other one is the government to increase on the funding of the veterinary sector and also recruit more extension workers. And that one comes across almost all the districts. Then we're also saying that we should depoliticize foot and mouth disease, because now we are going to the time of politics. We need to emphasize that we don't have to mix the two. This one is different. Development and politics was mentioned by somebody there. The other one is farmers who are reluctant to purchase vaccines should be denied access to livestock markets. I think that one has come back very strongly, and is the only way we can deter them from refusing to participate in this very important government program. Point number 7 is that government will continue to manage vaccines storage centrally, meaning that the vaccines will continue to be in Entebbe, that big cold store in Entebbe, and then we shall be picking from Entebbe from time to time, because we have no capacity to run our those stores continuously or throughout. Point number 8, on power fluctuation, we recommend the provision of solar power, especially to the regional laboratories for a start, and then later on we can move to the districts, because this one will be keeping more vaccines than those in the district. Solar and generators, the way it is in Entebbe, we can start it this side. Point number 9, we say that government will continue to manage other diseases animal diseases apart from the foot and mouth disease? Because somebody raised a point that, but now we are talking about FMD. What about other diseases? We are saying government will continue to manage also other diseases apart from this FMD. Point number 10, or 11, that we should commence vaccination against FMD as soon as the vaccines will be availed, rather than waiting for the animals to fall sick. And this is common with the neighbors. You know, the neighbors will say, oh, they are falling sick, let's now vaccinate. No, we are saying, let us do the vaccination all through. We don't have to wait, because the vaccine don't cure this disease, you must prevent it. A vaccine prevents, it doesn't cure. Those are the 10 points I captured from your discussions. But in the case I've skipped any, we can add, or in the case we feel one should not be.
From a scam, the challenge is implementation versus politics. And it is coming at a wrong time, where people want to look for anything to show that they are better. We have opposition in this region and in Uganda now that like changing. For them, they don't start something, but when you start, they change the other way around. Sometimes as a politician, I say, I think I just need to keep quiet until election time comes. Then you go, poor money, they forget. Let's forgive, but don't do it again. But for you, who does so many things, I have a program. When you vote me today, the next day, I give you the best polling station per sub-county. I give you a bull, rice, saucepans, 2 saucepans, or 5 million, and you celebrate, and some small money for other spices. Now, people forget that a week to election, they will not remember what you did a day after election. But they will remember someone who has not been there as long as he has finishing money. So the same applies with this kind of, when things come towards campaigns like this, I know what you're saying, and you know technical people are very good at shying off. You are in a burial, they are saying, oh, we have a DVO here. Let him tell us. We hear nowadays government no longer gives anything. Instead, they are asking money from farmers. Can you imagine? They are asking money from farmers. And when they take your money and your animals don't fall sick, what happens? You see how this government cheats. What? Then now, DVO, where you come? You are not used to standing in front of people. They shout, yeah, you talk. You people, you are the ones who eat money. How much did you collect? The DVO said, but we collected even less. No, you have eaten our money. And the person who is shouting has never paid even a coin. So then you say, what do we do? You say, this program of yours, I do appreciate. Coming here today at 9 to register, at 11 you are told government is bringing this program, at 1 you close. It's not enough to make you understand everything. And when you go and explain, and people pour you questions more than you have asked here, you say, those people also, I don't understand them. Government also, what? And yet you are also government. So these are some of the challenges that I know are going to be there. But I also like some people who said it is not only veterinary department that needs cost sharing. Everything in Uganda needs now cost sharing. And he said, let's not pretend. As we speak now, when you go to the hospital, because of very high population, medicine can be brought to the hospital today, the next morning they are not, like diabetes and high blood pressure. Those people who have high blood pressure and diabetes know exactly when their drugs come. And they book them even. So by the time the next day you go, the medicine is not there. So do you wait until the government brings the money? You just go to a nearest clinic. And nowadays there are people whatever medical people, whether they are medical quacks, they have stocked more than even the government. You now say, why would I leave this place, assuming now you have a nearest clinic here? Do you really go up to Mbale Main Hospital to line up? The doctor is in his clinic. By the time he comes, call you people, bring airtime, we call a doctor. Then you have to give airtime for calling a doctor. Then you, now, these ones even go with the loudspeakers like this one to the market. Are you sick? Are you sick? Do you have any? Do you know? Now there is extra. You need to know there is a Panadol, there is this one extra Panadol, but there is now extra. We have it here. And these herbalists have taken over the markets. People gather there. Men are running there. Men, are you fine? Are you okay? Come here. And men are running to buy medicine. Those days, women used to go and buy for charming men. But it seems that doesn't work so much. But this one of men now, do you want to be a real man? Come here. You find a man pretending, before you know it, he has already bought medicine. And after 2 months, he cannot even do anything. Now he regrets why he even went. So, these people who are, someone said here, that if a vet, some vet, by the way, our extension workers have now turned to be private extension workers. They have their medicines that they move around to sell. But they disguise like they are moving around for government, but they are selling their own work. So now, if you're a farmer, you have your animals. Do you wait for application and then you are what? But I want us to go with all that information out there. Go there as a district leader and tell people as much as we want these fast medicines, but they will affect your animal more than you looking for a vet doctor. For me, I can assure you, all my animals, if a district veterinary officer does not come and vaccinate, spray, all this, I don't. Because I know my district veterinary officer knows more. But for me to get anybody that so and so son, are you aware? Honorable Minister, are you aware? So and so son has just finished he has qualified to be a vet doctor. He is the one now treating our animals. The boy has not even finished 6 months at home. He has bought his medicine. He's now the one, oh, that's a son to so and so. He's the one helping us here. That's how they call it. The boy injects the animals, tomorrow this, another day, the same animal has fallen sick. And, they inject in the morning, the meat is slaughtered, people are eating in the afternoon. So we need to go and talk to people. And we also need to tell people, like PDM, the old women didn't know about application. Do you get now PDM without you passing through that process of putting your national ID? You need to have a phone which is in your names. You need to do this. But they are managing. School pay, I can assure you with the time, nobody will go to the bank to pay money already. A village man pays his fees. I told you I have 5 schools. They call me and say, they are these ones who are really not very good at. Honorable, you check whether man has reached. I've just sent, as if I'm at school, you know. But they send. It has showed here that I've sent money. Even my mother knows how to send mobile money. So mobile money already is digital. So let's encourage our people, you know, everything now is going to be digital. There are days when you go, whether you're a villager, when you take your child to the hospital, you will have to perform something digital before you. So let's encourage them. that as much as this, of course I am also concerned about taxation aspect. There are people, government brings a program, then they also add on their own and make things very complicated. When you're a DVU and somebody has applied, then you take 3 days, then you take what? You push people to quacks because you're not helping. Be there with now this, be there to support people. Say, for example, someone mentioned about the schools. If you don't give your child a uniform, and you say President Yoweri Museveni will give uniform, will give the books, will give the what? There is a gentleman from Serere who has kept calling me. Oh, I'm at the gate of Parliament. I want to see the Speaker. I said, you want to see the Speaker? Why do you want to see the Speaker? You know, the Speaker said students who have not cleared the fees should be allowed to sit for exams. But this head teacher of Kampala City High has refused my child from sitting. I said, this is not. Then after 3 weeks, he again called. I am here, I don't know if you are in the office because my child has not yet started exam. I said, now, which kind of behavior is this? Now, if I have to ask you, does UNEB register any school that has not paid to be registered in UNEB? They will not. But you want those schools to give free education, then you dodge. So these are some of the things that really disturb people. There are things that are very simple. Oh, government should treat our animals. And yet, it's like me, Fisheries Minister, I'm in trouble all the time. Hello, Honorable Minister, we have not got fingerlings and all this. You give fingerlings. Next year, they're asking for fingerlings. And feeds. You harvest, but after harvesting, you sell. Then after that, allow fingerlings. Why don't you sell? Use part of the little money, then you save some to buy more fingerlings. I don't know if you people have noticed this. I know the DFOs are not here, but every day you find the same people with the fish ponds are the ones asking for fingerlings. Every day fingerlings, they don't grow. They don't start, they don't take off. So, vaccines. But now why not register? Your name is already there. You are the priority of government, anything, you will be the priority. So let's go and talk about it. You may not manage everything, but we shall continue supporting you. And then also, I have liked the aspect, Tororo people said, why don't you make ours regional? But I've liked the aspect of every district strengthening theirs. It's better than, because when you look at Tororo, Malaba, and all this, you don't have as many animals as, because how many doses this regional, how many doses do you? Sate, the lab, the regional lab.
The regional lab, they say they are picking 30 samples per month.
So certain samples is very small.
It's very small.
You end up investing in for not much. So
because they are supposed to hand about 600 at least.
600. So you can imagine. So, but also, as I give back the moderator, district leaders, I'm happy 7 of you first district leaders are here. LOC 5, RDC, and all this. What makes me really sometimes disturbed? Why don't you don't do things? I know government does things sometimes in a uniform way, but why don't you, as an individual district, do your own, sometimes your own rules of the game? I think first of all the participants appreciated the cost sharing. than leaving government to do things, and they appreciated that in all sectors, government should just give people to cost share, because according to them, whether medical, whether education, whether all needs, really, let's not push everything to government. Let people know that, especially now with agriculture, people should know that farming is a commercial activity where they can earn millions of money. They all appreciate that. But where participants have got a bit of challenge is on two things. You know, when they make it digital, the local farmers will find a challenge. They will need other people to help them. And you remember the issue of PDM. Some old women who were helped by some people ended up charging them, ended up complicating things. So that's the aspect they are talking about. Then too, they feel this application is a long procedure. They want where they can just, I need my animals to be vaccinated, and within a day or two, the veterinary officer or extension worker in that sub-county is there to help. So that is where the challenge is. Otherwise, they really appreciate that we have even delayed, because they have been struggling with the treatment of their animals, and the extension workers are not really supported financially. Sometimes you call the extension worker, he tells you he doesn't have well, he doesn't have facilitation. So when government now opens up that government can do this, but as a person you also do this for yourself, so that together we can be able to make agriculture really a commercial activity.
They are done.